Hello. We're going to be discussing camphor. Camphor. We all know what camphor is. Yeah. So we use camphor to, get rid of insects, rodents, and all that, which is good and it works. But there are some homes that shouldn't have camphor in it. Like sincerely, seriously, if you are having kids, my brother, my sister, if you have kids, avoid camphor, especially when your kids are still 2 years on and under. Please avoid camphor. You can do without it. You don't need it. Okay, avoid camphor. Why? Do not bring camphor close to your child, especially your male kids. Why am I saying that? Most male kids is something that is inherited, and it's common in Africans, right? There's something we call G6PD enzyme. Is usually most times lacking in male babies, right? And this G6PD enzyme actually helps to protect the red blood cells from rapid breakdown. Yeah, so if you understand, am I flowing well? So if you lack it, if you are deficient in G6PD enzyme, then there's going to be a rapid breakdown of your red blood cells. This leads to an increase in what we call bilirubin, and it gets absorbed into the blood. Your liver is at risk. Boom. You see your child starts to have yellowing of the eyes and the skin and all that. That is what we call jaundice. Yeah? If it gets too much, it can get into the child's brain. And the brain is still underdeveloped. When it gets into the child's brain, we're talking about seizures, high-pitched cry, intolerant cry, high irritability. Right? So, once you start to see your child is behaving in a way, is highly irritable, having seizures, drowsy, a child that you used to feed 2 or 3 bottles of Infamil, for example, or feed well, breast milk and all that, this child doesn't want to feed again. Poor feeding. The eyes are yellow. The skin is yellow. Rush to the hospital. Please, you cannot compromise. There are certain things that you cannot start typing on the phone. Some people will go to the groups where they belong and they will start typing. My child's eyes are yellow. The skin is yellow. Come on. Even if there are doctors and nurses in the group, they are not going to provide you with this immediate medical care that your child needs. Take your child to the hospital immediately. There are certain things you can actually ask advices in the internet, in the groups you belong to. Not everything, not serious matters, like you see your child having yellowing of the skin and yellowing of the eyes and all that, and you're asking in the group section, what should I do? My sister, that is jaundice. That child needs immediate medical care. Not online advice from online doctors and nurses, because they cannot do anything. So do not expose your children that are under 2 years of age, especially the males, because of the enzyme that I talked about, the G6PD enzyme that is usually deficient in these male kids. Do not expose your child. to camphor. There are other ways you can take care of these rodents and insects around you. If you feel your child's clothes are not clean enough, or the smell is not good, put it in a washing machine and wash it. Put it in the basket, take it outside, get your bath, pour your detergent or whatever, your soap or whatever it is you use to wash your child's clothes. Wash. It is better. Wash as much as you can wash. Stress yourself. It's better you stress yourself and you have your child than you're putting camphor and the next minute you're running to emergency. You might not be too lucky. You might lose that child. Jaundice is not a joke, especially when the bilirubin becomes too high in the blood. Trust me, jaundice have been the reason that so many mothers have lost their kids. Thank you.